Are you planning to have a surgery for whatever reason and jumping on a flight immediately? Stay with me. I am going to share with you why can't you fly immediately after a surgery. Hello travel lovers! For those of you who don't know me yet, my name is Anna Maria, a former flight attendant with a decade of flying experience. I've created this YouTube channel to help people like you all over the world in achieving your dreams and goals in becoming a flight attendant. On today's episode, I am going to share with you why can't you fly immediately after surgery? When it comes to aviation and medicine, there is still a lot to be discovered. And not all the doctors, unfortunately, are aware of the harm that flying and altitude can do to your body. Since I have seen many medical emergencies on a flight, it's not a joke to treat it lightly and fly immediately after the surgery. It might lead to complications that you could not even think of. Before you step foot on a flight, consult your medical care provider and ask him when it's safe for you to fly. Then plan your trip accordingly. If you do not care for your own health, then care about your loved ones. Flying immediately after minor surgeries is rarely dangerous and poses little risk to post-surgical complications. However, air travel can harm a person's health shortly after a significant surgery. This can often lead to infection, deep vein thrombosis, and blood clots. Bear in mind that after a surgery, your immunity system is definitely lower than regular. And when you are on a flight, you are not going to be spared from catching viruses. After a surgery, you should move and walk around as much as possible. A prolonged lack of movement increases the risk of blood clot forming. In addition, the lower air pressure during a flight also increases the risk. For this reason, the recommendation is if you had a blood clot recently, you should actually not travel for at least 4 weeks. I am pretty sure now you're asking yourself how long should you wait after the surgery and when is it safe to fly. The good news is that you can fly after a day or two after a laparoscopic or keyhole surgery. If you had a cataract or corneal laser surgery, you can fly after a day or two. If the surgery was more complicated, then after 10 days. For a normal abdominal surgery, you can fly after 5 or 4 days. If your abdominal surgery was more complicated, then after 10 days should probably be the case. For a nasal or facial fracture repair, you can fly after 2 weeks. If you had an orthopedic surgery involving a plaster cast fitting, then you can fly after 1 to 2 days. This one is very serious. If you have a pacemaker or a cardiac defibrillator implantation, you can fly as soon as you're medically stable. If you must fly after a brain or neurosurgery, then you can only do that after 6 weeks. You should not travel on a long-haul flights for at least 3 months if you had a foot surgery. This includes operations such as ankle fusion or tendon reconstructions. You should not fly if your leg or foot is in a plaster. And if you did have a bunion intervention, then you should not fly for at least a month. Yes, it's true, all flight attendants have a first aid training and we are willing to help you out. But you must be aware that we are not medical professionals. And at 40,000 feet, your options are very limited. Not to mention, if we do fly across the ocean, it's highly impossible to have a diversion. For any questions you might have regarding the lifestyle of a flight attendant or how to become a flight attendant, I've created specially for you a monthly live event on my Facebook page. To be able to participate at my live event, make sure you do follow me so you don't miss the notification. I thank you so much for watching, and if you did find this information useful, do let me know in the comments down below. Subscribe to my YouTube channel and why not like it. Until next time we meet, let your wings spread and fly as high. Sky is your limit, and who knows, I'll meet you up in the sky.